Are you happy with your body? Do you have the figure you want? If you would love to improve on what you have, there are several procedures that can deliver without surgery. Joining me to discuss options for body sculpting is Dr. Therese Stubbs with Therese Aesthetic Medicine. Dr. Ann, nice to have you here.
Thanks for having me back.
We talk about body sculpting, but really different people are different sizes, weight, height, so there are different ways that you talk to folks about what they really need, isn't there?
Exactly, and we find that a lot of folks present and just don't know what's out there. They've heard a lot of different terms in the press. They've heard a lot of things from Hollywood. They've heard lipo, they've heard smart lipo, they've heard cool sculpting, and so they really come in and they don't know what modality is best for them.
And their body.
Exactly, and different things work differently for different people, and so we always encourage people to kind of come in and learn all about some of the different procedures that are out there, and some of them aren't even procedures. They might be, you could start this low glycemic diet and really change your body.
Well, let's start with, because we're going to talk about 4 different procedures. This first one is smart lipo, not lipo, smart lipo.
Smart lipo is laser liposuction. So this is a lot less downtime than traditional liposuction. There's the skin on top, there's a layer of fat, and there's muscle right underneath. So this layer of fat is what is attacked with smart lipo. There's a little bit of numbing medicine put right under the skin, and then a very tiny laser about the size of a piece of angel hair pasta is just kind of introduced right under the skin, and you can move that back and forth very gently and melt the fat. And so the melting procedure, the heat, causes the skin to tighten over top of it as well. So basically we can remove that fat, liquefy it, and then remove it, and then we can tighten the skin down over the top of it. So that is a whole lot different than traditional lipo, which was fraught with a lot of trauma,
I was going to say, it sounds much easier
downtime.
On the body.
Much easier on the body, much less recovery, and patients are awake during all of it under a local anesthetic, so no risk of general anesthesia.
Okay, the next one is cellulase, because cellulite can even occur in folks who are thin.
It can, and cellulite is something that, like you said, skinny girls can have cellulite. Cellulite is particular to women, though. We found through studies that cellulite is due to like little rubber band septae kind of pulling the fat down. So you have valleys and you have hills, and that's what's causing the dimpling in the skin. So it's really right underneath the skin, there's these little septa that pull down. Now, women's grow vertically. Men's grow at an angle.
Not fair.
So men don't get cellulite. Not fair at all. But we go in with a very similar laser to the smart lipo, very similar procedure. We put that right under the skin, and we actually cut those little septae with the laser, and it smooths the skin right out.
What are the typical results for that?
That is something that you can see a result in about a week or 2, and then those results get better and better until about 3 months is actually the best result. The studies for that procedure are out about 3 years, and they're finding that women don't get the cellulite back.
That was my next question. Okay, that's good news.
It's a one-time permanent solution to cellulite, which is really unheard of. This is a new procedure that just came out this year.
Okay, cool sculpting.
Cool sculpting is a non-invasive procedure, and that's brand new in the last 18 months as well.
What does non-invasive mean?
Non-invasive means where there's no break in the skin.
Oh, all right. Okay.
So this is something that has just a kind of an 8-inch suction cup type of a edifice that just goes on the side of the body. It pushes the fat into this, or kind of sucks it up right into it. And this is, as we say, pinchable fat. So if someone can pinch an area, tummy, love handle, even bra fat up here on the back that plagues a lot of women when they wear a tank top or a camisole, if that can be pinched and pulled away from the body, this suction device can kind of pull it up. It freezes the fat, and when the fat gets to about 31 degrees Fahrenheit, the fat cell in the body breaks open. And so after an hour of sitting with this machine on, that fat is frozen. Over the next 2 to 3 months, it naturally is cleared from the body by the body's lymphatic system.
Wow.
So there's not a mark on the body. Someone comes in for an hour, and they can leave and kind of wait about 2 months. And so it takes a little longer than the liposuction procedure, because you don't have immediate results, but over the next 2 months, people can lose 1 to 2 inches in that pinchable area.
Well, we have one more, and as I said, you will talk with folks and discuss with them which is best for them. Finally, Fit Trim Life, which really isn't a procedure. It's a
low
lifestyle?
glycemic diet. It's a lifestyle change. And we found that a lot of people who presented to the office for liposuction really didn't know how to eat. They said, I've tried and tried to lose this weight, and I've been unable to get it off. And we were trying to help them eat in a healthier fashion. Sometimes if 20 or 30 pounds comes off in a 12-week period, and that's typical with this diet program, and we try not to call it a diet, we try to call it a lifestyle change. We're teaching people how to eat a low glycemic diet. And then even on the run or in an airport or traveling with restaurants, how do you pick the right choices there that are not going to put the weight back on? Sometimes you can eat something that's slightly unhealthy, but if you pair it with something with its higher protein, it might not send your blood sugar up quite as rapidly. So teaching people how to eat. And that's usually a 12-week program. Sometimes it's paired with a little medication called phentermine that decreases the appetite and increases the metabolism. And there are very strict regulations on who qualifies for
And
that.
if folks are going to do some of these procedures with you, they really should back it up with then trying to do the exercise. And we have a quick before and after picture. I'm not sure which procedure this is, but it's just to give folks an idea what can be done.
Yes, this is cool sculpting. This was just cool sculpting on the abdomen, and what we call the love handles are kind of the flank area there.
That is a good result.
Yeah, and that's without a single needle mark and no break in the skin. So that took about 2 to 3 months to achieve, but inches are definitely lost with the freezing technique.
Dr. Ann, that's all fascinating. Thank you so much for bringing it to us.
Well, thanks for having us.
Sure.